everyone, my name is Belen and today I'll be talking about de Quervain's tenosynovitis. So if we break down the word, de Quervain's is the person who came up with the condition, and tenosynovitis refers to teno, which means the tendon, syno, which means the synovial sheath, and itis is the inflammation. It's also known as mommy thumb. So de Quervain's tenosynovitis is a form of tenosynovitis that affects the first dorsal compartment of the wrist right here, or some of the tendons on the wrist below the thumb. This region is a segment of the fibrous tunnel that separates the finger extensors tendons as they enter the hand. The tendons responsible for moving the thumb away from the rest of the hand are the abductor pollicis longus and the extensor pollicis brevis, which are specifically affected because of by de Quervain's tenosynovitis. This condition is caused by thumb repetitive motions like typing, texting, hobbies, and can cause connective tissue that covers the tendon or thicken. They also call it mommy thumb because when a new mom picks up their baby, it's constantly tugging on them right here. The inflammation of a tendon or group of tendons is referred to tendinitis. On the other hand, tendon and synovial sheath inflammation is referred to as tenosynovitis, so that's the difference between tendinitis and synovitis. While a tendon in the body can become inflamed, tenosynovitis can only occur in tendon sheath enclosed tendons. A clinical diagnosis of tenosynovitis can be made by physical examination. It often manifests with pain, swelling, limited range of motion, difficulty gripping objects, and pain that worsens with certain movements. There can also be a popping or a clicking sound when the injured tendon is moved. A way to see if you are positive for this condition is by doing the Finkelstein's test. So what you want to do is wrap the fingers around the thumb like this, and then ulnarly deviate your wrist. And if you have pain at the base of the thumb here, then you are positive for that. Pain in the distal radius. The majority of non-infectious tenosynovitis, because it can become infected, but it's mainly treatable with non-steroidal anti-inflammatory drugs and NSAIDs, such as ibuprofen, immobilization of the affected area, and rest. In order to lessen inflammation, if the NSAIDs are ineffective, a corticosteroid injection can be administered if the symptoms don't go away after receiving after months, surgery can be considered as well, but that's in the more extreme cases. Now, as far as OT, what we can do with the patient that has this condition is provide a custom splinting, or just order a splint for them, recommend one, which would be a thumb spica. That's to immobilize the thumb and the thumb base and the wrist. We can also do some manual therapy to reduce the swelling, therapeutic stretching, PAMS, we could do ultrasound. I did have a patient with this condition, and we did ultrasound, paraffin, e-stim, and just tried a few things to see what worked for him to reduce the overall pain. And my CI actually even did like some scraping with the, it's like this metal tool, and also educating them on joint protection techniques in order to reduce the pain and swelling during functional tasks. And as progress is made in decreasing pain, we can begin strengthening from active range of motion and weaning the patient from the splint and performing more functional tasks. This continues until the patient is back to normal with range of motion and strength without pain. So we just kind of have to respect their pain so that it's able to heal. But yeah, those are some things that we could do as occupational therapist intervention.